interactive session and I want you all to answer in this session. Okay. So where have I got these DNB OSCEs from? These are actually collected by the previous DNB students who have taken pictures and they have gotten these questions and they have shared it with their juniors. So these are literally from the exam. Those who are exam going, I would love it if you could guys could attempt to answer this and see how easy or difficult it is to give DNB OSCEs. All right. So the lecture is divided into two parts. Today we'll be doing a few of the OSCEs that have come in the exam, and tomorrow we will be doing the rest of them. We have a collective of 14 total. And we'll try to finish it off in 2 sessions. If not, I would love to take more sessions for you all and make sure that you all complete the OSCE. So with that, let's begin with our first OSCE. This has come twice in the exam. It's on biomedical waste management. So they give you on the screen a PPT in which they have these questions and you have to write the answers. So the first one is name any items discarded in red bag, yellow bag, white bag, and blue colored container. The second thing that they have asked is, what are the 5 recommended methods for biomedical waste management? Third question is, what is the ideal disinfectant for surface of trolleys or bins infected with COVID-19? So this was during the COVID times, the DNB exam that was held at that time. And what is the color of the container used for discarding COVID-19 PPE kits? All right. So can I have any of you all try to answer these questions for me? Anyone wants to answer these questions? Okay. We also have the chat box. So you guys can answer in the chat box too. Chalo, bolo. This is from PSM actually. बहुत time हो गया PSM करके. So any items discarded in red, yellow, white, blue colored containers? Okay, very good. Gautama is saying anatomical waste is discarded in yellow container. Absolutely right. So if we are talking about any of the tissues extracted, any organs removed, placenta in females during LSCS, all these are discarded in yellow bag. Okay, what is discarded in the red bag? Any idea? Red bag, blue bag? Awesome. Ayushi is saying that gauze, gloves. Okay, Ayushi, you're saying gloves are discarded in the red bag. Can you tell me whether these are used gloves or unused gloves? Used gloves or unused gloves? Okay. You all must have used these kind of bags in your hospital, right? Prachi is saying in white containers we put sharps. That's absolutely correct. And in blue we put drug vials. And in black we put general waste. Absolutely correct. So let's quickly have a look at biomedical waste management. So first thing is, in the black bag, we put either paper or we put cytotoxic waste. Okay. Now, how do you remember that? I have a very easy mnemonic for it. Can you see this paper is burning? Okay. So whenever the paper is burning, when you see burning paper, then this paper turns black in color. Okay. So that's how you can remember that paper is thrown in the black bin. Because whenever you are actually burning the paper, it turns black. Okay. So paper is thrown in the black bin. All right. Then the next thing is red bag. So can anyone tell me what all is seen in the red bag?
Ma'am, tubings and all.
Okay, awesome. Tubings are seen in the red bag. Is there anything else that you see in the red bag?
Gloves.
Gloves.
Okay, gloves.
Plastic waste.
Are these used gloves or are these unused gloves?
Unused.
Used gloves.
These are
Used gloves.
Okay, very good. All right, just give me 1 second because I'm trying to attach the writing pad so that I can write for you all and tell you all. Okay, so why I put the picture of the parrot over here is just remember this red color parrot. Okay, why red color parrot? Because red is the color of the bag that we are talking about. Okay, and how do you remember this? Parrot has 2 reds. Okay, so here I want you to remember red color parrot for red bag and look at parrot. P for plastic, R for rubber, and T for tubings. Okay. So plastic, rubber, and tubings, all these 3 go in red color bag. And for that, you have to remember this red color parrot. Okay. So is that an easy mnemonic for you all to remember what is there in the red bag? Just like I told you over here, once you burn paper, paper turns black, correct? You can see the black paper. So paper goes in the black bag. Okay. Now, next thing is, if I ask you in the exam, Foley's catheter is thrown in which bag? Can you all tell me Foley's catheter is thrown in which bag?
Yellow.
Red.
Is it yellow?
Red.
What is Foley's catheter made up of? Rubber. Okay. So
Rubber.
it will be in the which bag? It will be in the red bag. Absolutely. Okay. Now tell me, I've opened one IV set. I've used it for the patient in the OT and I want to throw it away. So which bag should I throw the IV set in?
Red.
Awesome. Because tubings are thrown in the red bag. Okay. And last we have plastic. All right. Now this is my most favorite mnemonic. So blue colored container. What do you throw in blue colored container? From your general knowledge, what do you throw?
Glass.
Ampules.
Okay, you see the used drugs ampules that you have. Used drugs ampules are thrown in the blue container. Now, how do you remember this? See, what is blue? The sky is blue. But if I'm in the house or if I'm in the OT, how can I look at the blue sky? I have to look through a glass ceiling. I have to look through a glass ceiling to see the blue sky. Okay. So from this, you can remember that a blue bag will have glass products or glass containers that are thrown in it. Now, what all is glass container in anesthesia? Bolo. What are the glass containers that you see in anesthesia?
Ampules.
Awesome. We see ampules, we see vials, all these are of used drugs. So these are thrown in the blue bag. Okay. And what is the last one that is left? Okay.
White.
So we have the white container. Now, can anyone tell me what is the full form of the white container? It is called as a white puncture
Puncture-proof.
proof container. Okay, white puncture proof container. Now, most of you remember what is thrown in the white puncture proof container. Can anyone tell me what is thrown?
Sharp.
Awesome.
Sharp objects.
Sharps are thrown. Okay. So what I want you to remember from your visual memory whenever we talk about white puncture proof container is this dirty t-shirt that this person is wearing. Okay. So this t-shirt is a white t-shirt and a white t-shirt having holes in it. Okay. So if you have anything sharp, it can create holes in the white t-shirt. Okay. So that is how you can remember that sharps are thrown in white puncture-proof containers. So are these easy mnemonics or are they stupid mnemonics? Yeah, so I also teach for NEET PG and most of the mnemonics that we learn are silly, but that's what makes them very, very attractive is whenever you have silly mnemonics, you tend to remember it in the exam and laugh and give the correct answer. Okay. So quickly going through biomedical waste, this OSCE of biomedical waste has been asked 2 times. So the first is what is there in black bag. So paper and also cytotoxic waste. Cytotoxic waste means any kind of cytotoxic drugs that you're using will be thrown in the black bag. How to remember cytotoxic waste? Cytotoxic means it's bad. Bad is which color? Black is bad color. Okay. Second thing is whenever you burn paper, it turns black. So paper goes in black bag. Then the next thing that we have is red bag. So you just remember a red color parrot for it. From P, you have plastic. So any plastic waste is thrown in the red bag. From R, you have rubber over here. Any rubber waste like gloves, used gloves or Foley's catheter is thrown in the red bag. And T is tubings. All right. So like your IV set is thrown in the red bag. Blue bag, what do you have? Actually, it's not a bag. It's a container with a blue plastic inside. So for the blue bag, you can remember we see the blue sky through a glass ceiling. Okay, so any glass containers are thrown in the blue bag, like your drug ampules. And the last thing is white puncture-proof container. So just look at this white color t-shirt with holes in it, okay, which are created by sharps. So sharps are thrown in white colored container. Okay, awesome. So we've done the mnemonics. That's the first question that we've completed. Now, can you tell me 5 recommended methods for the management of biomedical waste? Now, you all would have studied this pehle. Very simple methods. How can we sterilize? What are the ways of sterilization?
Autoclaving.
Autoclaving. Very good. So what do we do in autoclaving? What are we using to sterilize the microorganisms that are there on any surface? Yes, so awesome. You know what we are doing in autoclaving? We are using superheated steam. We are using very high temperature steam. And because of the high temperature, the steam will inactivate or it will kill the microbes. Okay. So Prachi has mentioned here. So whoever's having that background noise, please mute yourselves. Though I want the others to answer. Now, Prachi has mentioned incineration. So, in what do we do in incineration?
ఇది రికార్డ్ ఎలా చేసుకోవాలి
Yeah,
Burn.
what do we do in incineration, guys? We burn whatever is the waste. Okay.
చేస్తున్నాను
Okay. Third thing is autoclaving. So in autoclaving, what do we use, guys? Again,
Steam.
autoclaving we
Already
use
already recording
autoclaving is steam only. Ethylene oxide. So what kind of sterilization
ముందు
is
ఇట్లా ఉన్న
ethylene
ఆర్ఎస్
oxide?
తెలీదు మళ్ళీ జాయిన్ అయ్యానా వెళ్ళేసి
Okay. What kind of sterilization does ethylene oxide do? Is it a chemical? Is ethylene oxide a chemical?
Gaseous.
Yeah, so it is a chemical. All right. Yeah, Priyanka is mentioning there's a lot of disturbance. That's because we have many participants who are talking to their friends. All right. So, Mukta, if you're there.